Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, my name is Tammy Ross, and I'm joined by my colleague, Arlene Maxim. Welcome to our presentation on how Axxess is helping solve workforce challenges with our innovative technologies. I lead the professional services division here at Axxess and have worked in post-acute for about 30 years as a clinician and an executive. As you know, workforce management has always been an area of focus for leaders, but it has never been as critical as it is today. John Alajide, the CEO of Axxess, approached me last year with a vision to add real value to the industry and workforce management. He'd already addressed staffing challenges by using technology to manage a limitless supplemental staffing pool through Axxess Care. But this was going to be how to ensure competence and competency in our staff. So in the next few minutes, I'm going to show how our workforce training and development platform actually helps organizations increase staff recruitment and referrals, streamline staff onboarding and training, develops competent and compliant staff, enhances staff professional development and career advancement, improves employee satisfaction, and in the end, honestly, elevates the status of an agency. I think you're probably familiar with a survey conducted by Home Healthcare News. It kind of validates the need for an overhaul of what we're doing in terms of workforce. When we look at that survey, we see that 74% of organizations are having to turn away referrals. That's going to decrease business. I'm sure you understand that turning away referrals doesn't just affect today, it affects tomorrow and future business. 75% of organizations state that they're willing to make an investment in their staff for staff development. To me, both of these indicators means patients without care. That's the nurse coming out in me. Every referral turned away is a potential patient without care. Recruitment and retention strategies around compensation and benefits and sign-on bonuses still lead the way at the very top of the initiatives. However, we know this has a ceiling. We know of a nurse position, a case manager position in Michigan that has a $50,000 sign-on bonus, but yet that position still goes unfilled. So looking at new ways to manage that through flexible staffing and job sharing, and really investing in different labor pools, such as we see at Axxess Care, are things that organizations are starting to look for. Lastly, it's staff needs. Turnover rates for nurses are only about every 18 months. So that means a new nurse cycling through every 18 months. This is costing our organization about $50,000 for each nurse who turns over. When we looked at the survey results surrounding this, of course, wage and hour kind of hit the top, but you can see that work-life balance was closely followed at 21%. And interesting to me was those that left to pursue an opportunity outside of the healthcare industry. I think this is because they wasn't confident and competent in their skill set, which led them to look for work outside of healthcare. Axxess certification addresses these issues. And if you'll give us a few moments, we'll just watch a brief video to kind of introduce you to it.
The Axxess Certification Program is an online curriculum that has been designed to create a standard of knowledge and competency to ensure optimal care outcomes, maintain compliance, and grow business. Through the program, leadership and staff at all levels of home health, home care, and hospice organizations receive training and resources through carefully created modules that can be completed in 20 minutes or less, and participants are then tested on how well they understand important aspects of the caregiving process. Professionals can earn certification all the way from foundational to expert levels of understanding across clinical, operations, and financial tracks. The Axxess Certification Program is unique because our courses combine industry best practices with Axxess solution training to enable the highest quality care. Online courses provide ideal training and professional development for new and existing employees. With the Axxess Certification Program, organizations stay ahead of industry changes and can deliver care with confidence.
We are dedicated to partnering with the industry to improve and increase workforce development and have included our certification platform right here on our clinicians dashboard. Every user on Axxess will get a free complimentary Axxess Certification Premium account, giving them access to all certification and training courses across all service lines, home health, hospice, and home care. You're currently looking at the dashboard, and if you'll look to the left, you can see the videos or learning modules, kind of similar to what you saw earlier, and it also provides just-in-time learning. Next to that, we have our badges and credentials earned for all courses taken on the platform. These address the primary reasons for turnover, such as career force development, and really give that clinician a reason to keep investing in learning. The next section is our resources. And on our resource dashboard, you'll see that we offer both our user community, our product updates, and our upcoming events. And then at the bottom, you'll see that we're linked with first-in-class partners such as Decision Health and Care Academy. Both of these provide additional learning tracks for our users. Now let's look at courses assigned and on the dashboard. Our role-based training makes it really easy to cross-train staff, and the badges available entice staff to explore additional certification opportunities. We can look at courses completed for reviews so that that nurse can actually have that information at a later date if she needs it. So let's take a deep dive into one of our courses. We're going to look at the OASIS module. All training is divided into small modules like you see here, based on best practice for adult learners. Prior to viewing the materials and videos in each module, we start with a pre-test that is not graded. This test just reinforces learning objectives and focuses the person on key concepts. Resources, as you can see, we list several resources here, such as the OASIS Guidance Manual, and then also the OASIS Walk. So the ability to perform an OASIS has always been a challenge for organizations, and we make that easy using our transcripts. So we'll take a look at our side-by-side transcripts before we start the video. This is offered in both English and Spanish, but soon it'll be offered in multiple languages as it supports Axxess global implementation of our solutions. So on the left, you see a video concerning OASIS, and we really tried to address the age-old problem of being able to perform an OASIS efficiently and effectively. So take a note of the video clues that are on your left-hand side as this video plays.
Hi, I'm Tammy Ross with Axxess Professional Service Division. Today, we're going to take you on the Axxess OASIS Walk. We're going to teach you how to score OASIS timely and accurately. We know how vital OASIS is to outcomes and honestly to revenue. So join me and my patient, Mr. Allen, as we do the Axxess OASIS Walk.
All right, well here we are. This is my bathroom.
Mr. Allen, you're sounding a little bit winded. Do you want to sit there on the commode while I wash up my hands?
Yeah, that'd be great. All right, if I can. Sorry.
No, that's okay. Not a problem. Let me just get my hands washed up. I'm going to do this every time I come in just to kind of keep you safe, okay?
All right.
I notice you have some oxygen tubing there. Do you wear oxygen at night or when?
Oh yeah, I've got a machine in there in the bedroom, and I wear that at night while I'm sleeping.
Yeah?
Yeah, I've gotten more out of breath during the day. I guess I'm going to have to start using something today. I've kind of really gone downhill ever since my wife left. She left with that old so-and-so that used to cut our grass. I don't even get our grass cut anymore.
I see you have a urinal back there. Do you usually use that?
Oh yeah, I forgot to take that into the living room this morning.
I'll get that in there for you before I leave today. Also, looks like that's adult briefs. I see one back there. Do you wear those occasionally? You have problems with your bowels?
Yeah, every once in a while. I have that IB, irritable bowel something or other.
Irritable bowel syndrome?
Oh yeah, that's it. That's it.
Okay. Well, that's very common. So a lot of people have that when they have your diagnosis. Just looking back there, it looks like you've got probably not been using that bathtub much, right? Some pillows and stuff in there. It's a good place to store them.
Oh yeah, no, I can't get in there anymore.
Yeah, I understand. How do you get your bath? Does Darcy help you?
Well, Darcy, when she's
Right.
here, will just kind of wash me off a little bit, and when she's not, I just sit here and wash myself off a little.
Okay. Well, you know you were cold this morning. You got a couple shirts here. They look clean. I could put one on for you if you like.
Well, it's probably a good idea, but I don't like any of these in here. I got some in the closet though.
Well, let's go to the closet if you feel like you can. Can you get up now? You got your breath back?
Yeah, I feel like I got a little bit of breath.
All right, well, just take it slow and easy, and I'll be right here to help you.
All right.
All right, just watch your step there.
All right.
And we'll head to that
Yeah,
closet.
it's just right over here. Clothes and things in here.
Yeah, thank you. Do you see a shirt in there you want?
Yeah, this one right here would be okay. I just can't I can't reach up. This arthritis just doesn't let me raise my arms very high. I can't quite get anything down from here. That's kind of why it looks such a mess in here. I can't really sort it.
Can I get that down for you?
Would you do that? That'd be all
I
great,
sure will.
please.
You just come back here and
Yeah.
I'll reach in there and get that for you.
All right.
How about this shirt, Mr. Allen? Would this be okay? That's the one,
Yeah,
right?
that'd be fine.
Well, let's just go over here and sit on this bench and we'll get your shirt and your shoes on. With you being diabetic, it's really important that we keep your house shoes on you.
Let's get down here.
Here you go. Can you put this on for me?
Do that.
Here, let me help you. Is that a little painful for you?
Yes, kind of arthritis to act up a bit when I do that.
Yeah, probably makes it hard reaching into there, huh?
It does, yeah. Oh,
All right.
I get out of breath too.
Well, take some time, get your breath, and here's your shoes. Let's put those on.
All right. Oh, I just can't quite reach my toes this morning. Tell you what, just put them down there. And see.
They look comfortable.
Yeah, these are pretty good. Pretty good shoes here. Well, I can get them halfway on. That's pretty good.
Well, you know, that can make you fall, so let's get them all the way on, okay? All right.
All right.
Let me help you with that.
Okay.
There we go. And let's get this one. What do you think about if I have an occupational therapist come out here and help you learn some dressing skills? Just help you.
Yeah.
Yeah?
Any help would be appreciated, yeah.
Certainly. And then also, I think we'll get a home health aide out here to help you on the days that Darcy's not here. Would that be good for you?
Yeah, you can't half count on Darcy to be here anyway.
All right, Mr. Allen. I'll get that ordered from you. I'll call your doctor.
Oh, that'd be wonderful, thank you.
Okay. Are you ready for us to go back in there and take a look at the kitchen now?
Oh, all right, yeah, let me just see if I can get up here and I'll show you. See what I got there. All right, just this way, back in here.
Okay, so after reviewing the resources for the particular module and seeing this video, the nurse would proceed to take a test, which he or she must score at least to 80%. We're going to pretend like they proceeded all the way through the start of care modules, which is really going to prepare her to become a start of care clinician. At this point, we're going to look at the continuing education and the certificate. Axxess is an American Nurse Credentialing Center provider. The certification tracks offer a total of 66 continuing education units. These are divided between home health, hospice, and home care. In addition, we offer required in-service hours for certified nursing assistants, caregivers, and Texas administration hours. Through our partnership with Decision Health, we offer OASIS and compliance continuing education hours. Now let's get to the fun part and post this to LinkedIn. Badges on LinkedIn demonstrate newly earned credentials, and they post immediately to LinkedIn, providing the user the opportunity to explore other advancements and new career paths. I know a nurse that posted their badge, and they said it increased their viewings by like 94% by posting their badge. It also gives the organization ability to get more visibility to really showcase those advanced skills of their clinicians. But certification is not all we do. We also do individual course tracks, just-in-time learning for value-based purchasing. And we track those using our advanced BI and reports. So let's take a look at our reports, and you can see how training can be managed remotely using this business intelligence. It allows organizations to see the progress of assigned learning courses across their organizations, and it really solves for rapid deployment of clinical staff, such as what we saw in the pandemic. In addition, it allows managers to provide encouragement to individuals who may be falling behind in their certification goal. So that was a brief overview of certification. And as a quick reminder, Axxess certification can help increase that staff recruitment and referrals by providing competent and confident staff. It really streamlines staff onboarding and training. It enhances staff professional development and career advancement. It improves employee satisfaction, which leads to improved patient outcomes. And it really elevates the organization's reputation. Used in connection with Axxess Care, the industry will have competent and confident staff that can perform care at the top of their license in an efficient and effective manner. I'm pleased to introduce Arlene Maxim to talk about Axxess Care.
Well, thank you, Tammy, for such a great overview of our excellent educational program through Axxess certification. This is a perfect segue into a discussion about our Axxess Care scheduling and staffing solution that has already been used to complete 65,000 visits. Having spent more than 40 years leading consulting with home care and hospice organizations, I'm very familiar with this workforce crisis. I especially understand the importance of finding high quality and motivated clinicians. That's where Axxess Care provides real value. Axxess Care connects with home health organizations with thousands of qualified nurses and therapists to provide timely care. Axxess Care is a result of a vision that our founder, John Lodgett, had years ago. He understood the growing need to more effectively distribute caregivers given the nursing shortage in our industry and the oncoming silver tsunami. Nursing schools are currently unable to keep up with the increasing demand for nurses and the acuity of patients requiring care. And as you know, the pandemic really highlighted the nursing crisis we now face. Organizations using Axxess Care have many opportunities. We can accept more referrals and increase revenue. We can reach additional qualified clinicians in their service area, ensure compliance with quality documentation, streamline operations and decrease costs, while we improve patient outcomes, reduce turnover, and improve workforce retention and satisfaction. Axxess Care may be the industry's best kept secret. It's not a staffing agency. It's a software that works very much like how Uber works for transportation and connecting drivers with riders. With this solution, Axxess Care connects organizations with qualified clinicians available to see their patients. This graphic shows just how easy Axxess Care is in 5 simple steps. First, the organization posts visits needing coverage. Second, nearby qualified clinicians that can then apply. Third, the organization reviews clinician applicants and assigns a qualified clinician to visit. Next, the clinician accepts the visit offered by the Axxess Care mobile app as confirmation. At this point, the nurse or the therapist has access to all the information needed to securely and compliantly complete the visit and related documentation. Lastly, the clinician is able to deliver timely care to the patient and submits completed documentation to the organization. As I mentioned, more than 65,000 visits have already been completed. These visits were among 1,500 agencies across the 50 states. We continue to see strong growth and adoption of this new approach to solving the staffing crisis. Clinicians love it. Easy access to the point of care documentation provides the most accurate and compliant documentation related to patient care. Organizations tell us that the most clinicians using Axxess Care turn in their documentation more quickly than their own staff. Axxess Care ensures compliance, resulting in successful state and accrediting body surveys and a satisfactory audits from the MACs. Organizations can expand the reach of care to the home to care for patients that they would not have been able to help without using this application. By using Axxess Care to optimize the marketplace, clinicians can easily be distributed to where the demand is. Now let's go to the solution for a look at the actual process. Let's take a look at a couple of screens here. Here we are on a web browser using the Schedule Center in Axxess Home Health, our cloud-based electronic medical records platform. And this is the Axxess Care mobile app that clinicians use to document and coordinate care with clinicians. Axxess Home Health is seamlessly integrated with Axxess Care. The Axxess Care application is currently only available to all Axxess Home Health clients as a complimentary benefit. Axxess Care was built on years of research and development that went into our flagship product. Most of the clinician workflow and the documentation features you see here today stem from this user-friendly and proven compliant solution. From this screen, organizations can post a single visit or multiple visits to Axxess Care. Most often, required visits are added by a scheduler. The teal hyperlink is used to actually post the visits to Axxess Care. By selecting the Axxess Visits task, we can match the visit with a clinician qualified to perform the tasks. Here, fields are available to edit the patient address and adjust the pay rate when necessary. There are no overhead costs for the organization. They simply pay the clinician. Now let's switch over to Axxess Care. Posted visits appear on Axxess Care platform for organizations as well as the Axxess Care mobile app for clinicians. Clinicians can immediately see new opportunities on the mobile application. These posted visits for the clinician will only show when matched with the clinician's license, their skills competency, preferred location and distance, and their preferred pay rate. Clinicians view the visit on the map and call or message the organization if more visit details are needed. When the clinician clicks apply, the posting organization receives the clinician's full application profile for review. The organization can review the clinician applicants for this visit. So now we will look back at the organization's view to see the applicants. We click to view the visit, and at a glance, I can see that and compare the skills and personnel files of all of those applying. Here I can see if they've worked with that particular patient, have completed their COVID-19 screening, have been rated by other organizations, and more. To see the entire profile, we simply click on their name. All required documents such as background checks, OIG checks, their license verification, as well as CPR and health screening records can be viewed here. This digital mobile human resources packet ensures organizations remain compliant with state and federal regulations related to the personnel files. Clinician star ratings and any other reviews from the organizations that the clinician previously contracted with are shown here. When ready, the organization can send the visit offer to the assigned clinician. Clinicians can accept, document, and complete electronic visit verification at the point of care using the Axxess Care mobile app. The visit notes go through the normal home health workflow, and the payment is released to the clinician. This shows how technology helps manage the entire process. Organizations using Axxess Care have many opportunities. We can accept more referrals and increase revenue. We can reach additional qualified clinicians in the service area, ensure compliance with quality documentation, streamline operations, decrease cost, improve patient outcomes, and reduce turnover. We can improve workforce retention and satisfaction using this application. We're really excited about the potential for Axxess Care to transform the way care is delivered in the home. It's an easy to use, and it's a win-win for organizations who need help to provide care and clinicians available to pick up extra visits. Thank you so much for listening, and I'm going to turn this back over to Tammy.
Thanks, Arlene, and thanks for that great presentation. Just kind of to summarize everything for you, I know you guys already know about the silver tsunami, 54 million seniors, 10,000 new members every month. But I think when we look at that with the open nursing positions, close to 200,000, and the fact that we only have about 26,000 new nurses graduating every year, it really shines a focus on the fact that, seniors are quickly outpacing the clinical staff. Without technology to close that gap, to offer more efficiencies and effectiveness, our workforce is going to get really weary and slip further behind, and I think they're eventually going to drop out. I'm proud to be a part of the Axxess team that is focused on addressing this clinical industry challenge, and we're trying to enhance it with care delivery using technology that includes mobile technology. Thank you and have a great day.
Axxess, empowering care anytime, anywhere.